I'm a physical therapist here at the Page Hospital. Originally, I'm from Ghana. I was born and bred in Ghana. I came to the US when I was 25. My main volunteering work is with STEPFAR, which is Stepping with Faith Rehabilitation. And we formed the organization, which I'm actually the founder from here, but it's based in Ghana. We spend about 3 to 5 days in each hospital that we go. And then we also had 3 seminars at 3 different regions where we gather all the other therapists from the region to one facility. And then the last time we went, we did a topic on stroke rehab, which is big in Ghana, and also cerebral palsy. The first trip, we only decided to do a seminar for the therapists. We were not going to do any inpatient care or help at the clinic. But when we were doing the training, the director of the clinic came up and said, "Would you guys mind looking at this kid for us?" The kid we were supposed to see had a meningitis. And for about 3 weeks, she was laying on the bed, has not been touched, has not been moved, and they were just giving IVs and medications because the nurses, they don't know what therapy really should be, or repositioning to help prevent pressure sores or stuff like that. So when we walked in, I picked the kid up and just started doing some very light range of motion, moving her hands and moving her ankles and things like that. And whilst I was doing that, I was talking to the nurse that was there, and all of a sudden the little girl opened her eyes. And she was laying on my laps, and the mom just stood up from the chair like I was a savior or something that just woke him up. And they said she hasn't woken up for about 3 weeks since she's been on the bed. So just that picture in my mind, I think, makes me feel like any little thing that I can be able to do will help somebody. The orphanage trips, normally because it's in my hometown, become the secondary casual when we don't have a day in a clinic or doing a seminar and I'm home. I spend the whole day in the orphanage, either helping them to cook or do some painting. I go back to Ghana at least once a year. The minimum time duration is 3 weeks. Anything I do in Ghana is a commitment that I think needs to be done. So to me, it's not a big deal, but to an organization like Banner, I think it's a big initiative because it helps people like me or other people in the organization to know that when you work for Banner Health, you are not only doing the day-to-day things that impact your patients, but also they care about the communities and the world at large.